Just a couple of things. You know, you were sitting here, so you've heard me mention that, again, I want us to do the job right, and I don't want us to be, to do wrong to folks out in the private sector while we're trying to do right. But I want to give you an example another member in the House brought to me in dealing with your office. So I'll get as specific as I can. He had constituents who came to him and said, once service that they provide was covered by Medicaid, they went to Health and Human Services, said, all right, this is what we're going to charge for this service. They were then told, no, you're supposed to charge this, which was more. Okay? And they said, well, no, we've been in the business for a while, and hearing aids, this is what we charge. They said, no, this is what you're going to charge because this is the charts that we have, or whatever the process was. And so the agency tells them to charge more. So time passes, right? 2 or 3 years pass, maybe longer. Then you come around and you go to them and say, we're charging you with fraud. I say, wait a minute, what do you mean charging us with fraud? Well, we're charging you with fraud because you're being overpaid. To which those small businesses all said, wait a minute, we went to the agency and we told them that this is what we thought we should charge for the hearing aids and for that service, and we were told to charge more. And your office says, well, no, y'all committed fraud. So the legislator or one of our colleagues gets understandably responding to constituents, goes and meets with your office. Your office looks at it hard, he lays it all out, and then your office says, well, you know what? It wasn't intentional fraud, it was unintentional fraud. Now, does that make sense to you?
I'm not exactly familiar with the case you're referring to.
Well, do you remember hearing about people in the hearing aid industry that you charged with fraud?
Well, if you're saying we looked at the record and thought there was a credible allegation of fraud, yes. We don't charge anybody with fraud. That's a Medicaid fraud control unit process.
You went to them and you said, you've committed fraud. We're going to go after you now because you've committed fraud. Do you remember that in the hearing aid industry?
I remember those cases, yes.
Do you remember, could you just enlighten me, or maybe all the committee members, what, in the end, what happened? Because it seemed to me, in that case, that it's a wonderful example of how someone in the private sector trying to follow the rules, and they're told, these are the rules, and you follow them, they follow them, then 2 or 3 years later, the left hand, this was the right hand talking to them, right? Then the left hand comes over 2 or 3 years later and says, no, we're going to say you've committed fraud. So, but it took the intervention of a legislator because you guys weren't backing off. And it took the intervention of a legislator to go and say, wait a minute, this isn't right.
Well, I think the provider hadn't provided any indication to us, any documentation where they got that information from the agency. So until the opposite of that, we can't back off.
I doubt that that's the case, with all due respect, Mr. Wilson, because let me tell you, generally, when my experience has been 20 years being here, you know, when people are dealing with government, they don't come to us until they've run into brick walls with you guys. That's when they come to us, okay? So, and I'm sure if the representative was here, he could verify that, because that's what he told me. Similarly, I want to ask you about the Xerox contract, ACS Xerox. We've talked about that in my office, you and I have, more than once. You told me, based on your experience, that you would consider what they did before the lawsuit was filed. Actually, the last time we talked about it, it was shortly before the civil lawsuit was filed by the Attorney General. And I asked you, based on your experience having worked at the Medicaid Fraud Division at the Attorney General's office, I asked you, what do you consider, how would you, everything you know, is this a criminal case or is it a civil case? You looked at me, you said, it's criminal. What these guys did is criminal. You recall that?
I don't recall making a comment either way.
Wow. Well, I'm glad I recorded it, so let me play it for you.
Okay, play it for me.
I didn't record it.
I'd love to hear it.
But you did tell me that, buddy.
One clarification, same issue. Do you mind, Senator Swartman?
Sure, certainly, please.
Go ahead, Senator Hino.
What you're saying is completely incorrect. So is not the problem. And let me read you from the report, okay? Cases languish for months to years, stuck in various stages of the investigative and sanctions process. The OIG caseload consists of 1,156 cases, 382 of which are more than 3 years old, a backlog dating back to 2001. Few cases resolved. Because cases are not efficiently investigated, OIG takes action on very few complaints. In fiscal year 2013, OIG established overpayment in 12 cases, including 11 settlements and 1 default. This represents only 2% of the complaints open in intake for preliminary investigation the same year. So your response to Senator Schwartner is incorrect. So is not the problem, okay? There's not where the backlog.
Moving on to the best practices of your office and how you administer the investigations and then the extrapolation. The actuary that fabricated the sampling data, there's a process that your National Association recommends, an external review of extrapolation on a regular basis.
The Green Book.
But my understanding is, at least I've been advised, that your office does not have a external review of extrapolation and had not instituted that until this era, or this fraud occurred in your own office. Is that true?
So, let me explain, Senator Schwartner. The Green Book is Social Inspector General puts out the Green Book, and yes, my office has, since I became IG, began to move towards Green Book standards. Here's the challenge:
we don't have Green Book standards now at the current time, even with what's happened.
We're implementing the Green Book standards, yes, so we are.
As a business person, that you couldn't run a business on that at all. So 11 cases for 11 employees. That's 1 case per employee. And now we've got how many in your?
And MPI has, I want to say, 103 now investigative positions.
And you have how many outstanding cases?
I can get you the number. There's a lot of cases still.
What they've
pending.
told us is there's 1,156 open cases.
That's
382 of those are more than 3 years old. What do you anticipate being a reasonable from 11 to 113?
19.
From 19 to 113, it's still going to take a year and a half to let
103.
these businesses know if they've been, if they're still under investigation for fraud.
Do you have any other questions? You have a tough job. I mean, we felt so strongly, and you've heard it from Representative Raymond, you heard it from Senator Schwartner. We expect you to root out fraud and abuse. That is your job. At the same time, your authority has to be used judiciously, because your actions not only impact the livelihoods of our health services, healthcare providers, but they impact access to services. And we are going to continue to look at the recommendations made by Sunset, and I think that there possibly should be there may be some modifications needed.